The United Nations Programme on HIV/AIDS, UNAIDS, has announced that taking a fast-track approach over the next 5 years will allow the world to end the AIDS epidemic by 2030. The new UNAIDS report, Fast Track, Ending the AIDS Epidemic by 2030, outlines that by taking the fast-track approach, nearly 28 million new HIV infections and 21 million AIDS-related deaths would be averted by 2030. We are joined by Professor Sheila Tlou, who is the UNAIDS Regional Director for East and Southern Africa, as well as the former Minister of Health in Botswana. Very good morning to you, ma'am. Thank you for joining us.
Thank you very much. Now, good morning, viewers.
Just tell us about the fast-track approach ending the disease by 2030. Is that realistic?
It is realistic if you look at where we are. So I think what I should do is to start with where we are, especially as a region, Eastern and Southern Africa, which is really the most affected region in the world. Yeah. Because really, more than half of all the new infections, people living with HIV and the AIDS-related deaths are in our region. So in our own assessment, let's look at where we are. We will say, okay, in terms of our vision of 0 new infections, 0 discrimination and 0 AIDS-related deaths, in terms of putting people on treatment, we now have 7.7 million people. As at the end of 2013, there were 7.7 million people on treatment. The world target is to put 15 million on treatment by 2015. And the Secretary General this morning reported that we have already 14 million. So that if we put those 14 million people on treatment, we know that we are also averting AIDS-related deaths as well as some new infections. So in our region, we've been able to scale up 7.7 million. But not only that, the scale-up is so rapid that between 2012 and 2013, we actually put 1.8 million, just like that. So it means if we can do that every year, we will be able to reach that.
We've got the fast-track targets on screen now for viewers to see what the sort of goal is. Based on what numbers do you see this by 2030?
We are now looking to say if we fast-track, let's say especially the treatment, and 90 is actually saying we want 90% of the people living with HIV to know their status. Because in the GAP report, which was released a few months ago, we found that of the 35 million people living with HIV in the world, only half know their HIV status. So 19 million do not know their status.
That's an incredible...
Therefore, the first 90 says 90% of those people should know their HIV status. It means we must make sure that people realize that right to access HIV testing and counseling services. And I'll be able to tell you later what we are doing in our region. The next 90 saying, of those who know that status, 90% of them should be able to access treatment. So it's a treatment scale-up, and we know treatment will prevent AIDS-related deaths, but also treatment is prevention. So it's really, killing 2 birds with 1 stone. Now, the last 90 is saying 90% of those should have their viral load suppressed, because we don't want people to adhere. And this is where civil society, like the activists who was before me, come in, because with civil society, they reach the lowest of the lowest in communities, and they can ensure that we reach those 390s. Yes.
Talking about those 390s, finally, ma'am, just talk to us about testing within this region, the challenges you face with testing, and we understand how important testing is.
Testing is very important because it is the first point of entry for you to access any service. So we need really to ensure that we work together with civil society to show people the benefit of testing, to have that demand creation for them to come over and be able to test anytime. I'll give you an example. When I was Minister of Health in Botswana, we introduced the voluntary provider-initiated counseling testing. So it didn't matter whether you came with a broken toe. The person who has attended to you would also say to you, would you like to know your status? Yes. And therefore, we reach high percentages in terms of people knowing their status and therefore accessing treatment. we were able to really roll out treatment to over 90% of the population within 4 years. That has yet to be accomplished anywhere in the region. So we know that's the first point of entry, and UNAIDS, therefore, is working with countries to ensure that people go for HIV testing. In fact, the past 2 days, on November 29th, we had 7 countries.
Yeah.
That's Botswana, Namibia, Lesotho, South Africa, Tanzania, and Ethiopia, rolling up and actually having HIV and cancer campaigns to just see how many people can be tested if we really put our efforts within an 8-hour period. Yeah.
Ma'am, thank you for joining us today. We've run out of time, unfortunately, but it's really a scary statistic that more than half of those people around the world, most of them in Africa, here in Southern and East Africa, don't know that they are living with HIV/AIDS. That's a very, very scary statistic. Thank you for, again. That's Professor Sheila Tlou, who is the UNAIDS Regional Director for East and Southern Africa, as well as a former health minister in our neighboring Botswana. Thank you for joining us again, ma'am.
Thank you.